Hello everyone, very good evening to all of you. So I have an interesting class lined up for you today. It's a short class and today I will be teaching you suturing techniques with the help of videos. Now unless we have really seen them in action, unless we have been to the OR or unless we have done them ourselves, we will be a little confused. And with the new NEET PG pattern, you never know, you may get some videos of some kind of suturings which we may need to know in an MCQ also. So let me try to make your life really easy today by giving you some video learning tips on suturing techniques. So do stay tuned for today's class. But before we begin, let me tell you a little bit about our platform. So I am Dr. Amrit Nasta, your surgery educator on the Unacademy platform, and I am a bariatric surgeon from Mumbai. Please follow my profile by downloading the Unacademy Learning app, where you will find the profile of myself and a lot of other educators who will help you with your preparation for the upcoming entrance exams. There are a lot of interesting batch courses, concise batch courses, which have just started. They have all started in March. So whatever exam you are targeting, whether you're targeting NEET PG 2021, which is less than a month away, or FMG, or so on, do subscribe to the Plus platform. And remember, this is the referral code to use, that is 10 surgery. This code will get you a 10% discount in whatever subscription plan you choose. Apart from that, there are a lot of free test series which are going on, which you should take full use of. I have taken a lot of videos like today on YouTube. The important ones were the GI surgery revision series. Please make sure you go through them. The GI surgery revision series as well as the special classes. So on the app, you will find a lot of my special classes. Recently, I've started the high yield series, which you should definitely watch, absolutely free of charge. They will give you a good practice on clinically oriented MCQs. Also, there are two subscription plans which you can consider taking. One is the Plus platform, other is the Iconic platform. On Plus, you get live classes, you have batch courses, there is a structured schedule. On Iconic, you get benefit of Unacademy as well as Prep Ladder. Prep Ladder has recorded video lectures, handwritten notes, and many more benefits. Depending on the exam you are targeting, think of a subscription plan accordingly. If you're targeting an exam next year, go for a longer subscription. This is the code to use. If you are appearing for exam this year, take a smaller subscription plan, maybe 1 month, maybe 3 months. Whatever plan you take, this is the code to use. This will get you a 10% discount in any subscription plan that you opt for. Now coming to today's class. Now, this will be mainly videos that I will be sharing with you. They are all my own videos, so no problem. Feel free to ask your questions. I can see your questions in the YouTube chat box where I will be replying. Okay, and do watch the videos over and over again if you wish to get a clear idea of the different types of suturing that are done in surgery. It's a very basic level class. These are the kind of questions you should definitely not make a mistake in. Before I begin, whenever we start suturing, we need two things. One is the suture material, other is a needle holder and a forceps. We know needle holder, forceps. Now you need to know what suture material, and a suture material has two parts. It has a needle and at the back it has a thread. So commonly they would ask you what type of needle is there on your suture. So let's see if you can identify by looking at the needle what type of needle is it. Is it a cutting needle, reverse cutting, taper cut, or taper point? What you need to understand is to identify the type of needle. Each needle has a different use. You have to look at the cross section and you have to look at the sharp edge. So let me see what you guys think about this one. I can see your messages in the chat box. Please ask your doubts over there. I will reply in the chat box. Don't worry about it. And do see the videos that I will be sharing as we go along the class about the different suturing techniques. Very useful. Very basic, very simple. You will never have a confusion after today about these kind of suturings. So about this type of needle, understand any needle with a suture thread on cross section will either have a triangular cross section or it will have a circular cross section. If it has a triangular cross section, it's a cutting type of needle. If it has a circular cross section, it will be a round body type of needle. Round body, also called as tapering type of needle. So this definitely is not round body. It's triangular in cross section. So it is a cutting needle. Now, is it cutting? or reverse cutting. Understand, if the cutting edge is on the inner side of the needle, this is the curve of the needle. If the cutting edge is on the inner aspect, it is a cutting needle. That is how any normal needle would be. If the cutting edge is on the outer side of the needle, as you see over here, it will be reverse cutting. So for those of you who answered reverse cutting, absolutely correct. This is a reverse cutting type of needle. I will give you a simple diagram, a simple table to understand the different types of needles. We only need to know tapering, that is round body, or cutting types. Now cutting, I told you, triangular cross section. If the cutting edge is inside, it is cutting. Triangular cross section, cutting edge is outside, reverse cutting. In your exam, they will ask you one of these. So these are the ones that we need to know. Okay, or tapering. Tapering, also called as round body. Now please understand, where do we use round body, where do we use cutting? Cutting needles are always used on tough tissue. So if I'm doing a skin suture, if I'm suturing the muscle, fascia, rectus sheath, I will use cutting or reverse cutting. If I'm suturing soft structures like bowel, okay, if I'm suturing the bowel, if I'm doing a vascular anastomosis, I will use round body needles because I don't want to cause too much trauma. All right, that is the basic that we need to know about the types of needles. Now I will show you the videos about these kind of suture materials, what we need to see in the suture material, what are the different types of suturing techniques. That is the whole idea of today's class. As the videos play, I will describe the videos. Okay, so this is the first video where you can see now what I need you to focus on. This is a suture material which comes packed. This is a 30 ethylon suture. You know what is ethylon, also known as nylon suture. And read over here the needle. So this is the needle, and you can see the triangle which is drawn to make your life easy. This is going to be reverse cutting. 30 ethylon is usually going to be used for skin sutures. Usually it's going to be used for skin sutures. Now what I want you to focus on in this video, so this is the suture material. See how the nurse places the suture on a sterile tray. See how she opened it. Exactly. That is how the suture is opened without touching anything inside in a sterile manner. So this is how a suture is opened. Okay. Now you need to see a type of suturing that I am going to do, a very basic type, and I will focus on some more points. See where I hold the needle. Okay. See where I hold the needle. So I have a needle holder and I have a forceps. Where I hold the needle, I'll just pause it over here. I hold it at the junction of anterior 2/3 and posterior 1/3. Anterior 2/3 and posterior 1/3, because that is the point where the needle can break. It is the weakest point. So you always hold it over there to get maximum stability, and then the needle will never bend. So always hold the needle anterior 2/3, posterior 1/3 to give it maximum stability and strength. Otherwise the needle will bend. So I took a bite from one side, came out from the other. Now see what type of suture I am going to take, and I want you to focus on the manner in which the suture is tied. I am doing it slowly so you understand it. This is not how surgeons normally suture, but I have taken it slowly. Now see, I took 2 throws, I held it. Now see how my hands are going. You see, my right hand is going on the opposite side, my left hand is going on the opposite side. Right hand went to the left hand went to the right. This is called crossing. Whenever I cross, the knot becomes secure. Okay, so please see this video again. Whenever I cross, the knot becomes secure. Now I'm going to take the second throw. Now see how I take the second throw. Now I've taken the second throw. Now see, my right hand is going right, left hand is going left. So it went the correct way. Now see how I take the third. Again I cross. So I hope you got the gist. Again I have crossed. So when I take the first 2 throws, I cross. When I take the next throw, I go straight again. When I take the third throw, I cross again. So I am always crossing alternatively. Because I am crossing alternatively, my knot is becoming squared. It is called squaring of a knot. If you don't get squaring of a knot, don't worry. I'll take a class on knotting techniques also. Today it's all about suturing. So this is what I want you to get a good grip of. So I sutured the two ends of the gauze piece like this. What type of suture is this? that I have performed. What type of suturing is this? Where I take one bite from one end, second bite from the other end, and just tie it. This is called a simple suture. Okay, this is the most basic suturing that we do. It is a type of simple suture. Now I will show you some different types of suturing techniques. Okay, just see the video. They will ask you those kinds. They will not ask you simple suture. They will ask you this kind. Now see, I went in from here, and then the needle comes out. Then I will go on the opposite side, and then I will do something. So be very vigilant on what I'm going to perform. It's not a simple suture. I will do something eventually. Okay, so I go in from this side, I come out from the other opposite side, and then see what I do later. Okay, and then you have to identify. I will see your message in the chat box. What type of suturing has been done? Okay, that's me right there doing the suturing. So I go in from here, come out from the other side. That's not the end. I'm not tying. I take another bite very close to the edge of the incision, and I come out from the opposite side. So I hope you have understood what I have done over here. Went in far from here, came out from the opposite side, came backwards, small bite, and came out from the other side. So I've taken 4 bites, and then I am going to tie it, and I'm doing it slowly so you can see clearly how the knot is being configured. He went in from here, came out from here, went back again and came out from here, all 4 in the same line. And now I'm going to tie it. So I want you to tell me what type of a suture is this, and I also want you to see how the knot falls. Okay, then I will pause. See how the knot falls. Okay, I have paused it. Went in from here, came out from here, went reverse, went in from here, came out from here, and I tied. All 4 are on the same side. 2 bites were very big bites, 2 bites were very small bites. Big bite, small bite, tie. What type of suture is this? What type of a suturing technique is this? Yes, please reply in the chat. So this type of suturing must know, and this type of configuration you must know, absolutely essential. This is called vertical mattress. Okay, this is called vertical mattress. In vertical mattress, big bite, reverse, small bite, and tie. Okay, this is called vertical mattress. Now see the other one. It looks similar. It looks a little similar. There is a little difference. Where do we use simple suture on the skin? Where do we use vertical mattress? Again on skin incisions normally. Normally on skin incisions. Okay. Now look at this one and you will tell me what this one is. This is the interesting one. They will either ask you the one I showed you before or this one. So now see how I am performing. Went in from one side, came out from the other. Now see where the third bite is. It is not in the same line. It is not in the same line. It is next to it. It is also a big bite. You see, I am quite away from the incision. And I come out again on the opposite side. Okay, I come out again on the opposite side. So I hope you have seen clearly how this knot is going to be configured. Okay, I'll pause it over here. Went in from here, came out from here, went in from here, came out from here, and now I am going to tie it. Yes, what type of suture is this? What type of a suturing is this? What technique is this? Yes, anybody? There are 2 names I'm looking for. One name I'm sure you will tell me. One name is horizontal mattress. Okay, one name is horizontal mattress. Everybody knows. What is the other name for horizontal mattress? Starts with a B. It's a 3-letter word that starts with a B. Please reply in the chat box. It's difficult to learn these things unless someone handholds you and makes you do it. And definitely a video MCQ of this kind you must know. You see how the knot is configured. You see how it is looking, how the final picture is looking. Okay, this is also called a box stitch. Okay, this is also called a box stitch. A box stitch is normally taken for hemostatic purposes. Like let's say there is a bleeding from the base. I am doing a surgery. Let's say there is a duodenal ulcer bleed and I am treating it surgically. Now when the ulcer is bleeding from the base and I can't pinpoint it, I have to take some suture on the top. Now one of the sutures that I can take is a box stitch. A box stitch will usually stop a bleeding in the depth. So where I can't pinpoint which vessel is bleeding, it's bleeding in the depth, I can take a box stitch. Okay, I can take a box stitch. That is the use of a box stitch of a or a horizontal mattress. Now I have taken a stitch already, and now I am taking one bite over here, and then you see how it's going to configure. Okay, this was the first stitch. I have fast forwarded it. Now I take a bite over here, and you see what I'm going to do next. I'll go through this video a little quickly because I'm sure you guys have an idea of what is happening over here. So I started at the tip of the wound, went in from here, came out from here, same suture going in from here, and then I will come out from here, and I'm going to continue in the same vein throughout. Okay, I'm going to continue in the same vein throughout and see how this is forming. Okay, see how this is forming. Started from here, came in from here, out from here, in from here, out from here. I'll go in the same way, in, out, in, out, in, out. This is a continuous suture. Okay, this is a continuous suture. I am sure you understand this kind of suturing where this is commonly done. Anybody can tell me, where do I do continuous suturing? What is the principle? Where do I do continuous suturing? Where do I do simple interrupted suturing? The first stitch that I showed you was an interrupted stitch. I would do it repeatedly on the skin. Where do I do a continuous suturing like this is what you need to understand, right? So continuous suturing I normally perform where I require a watertight closure. Okay, where I require a watertight closure, like if I am doing a bowel end-to-end anastomosis, if I am doing any bowel anastomosis, vascular anastomosis, where I want a watertight closure, I would prefer doing a continuous suture. Okay, I would prefer doing a continuous suture. I hope the videos are absolutely clear. Now, this is the last one that you need to see, the last video that you need to see. Then I'll give you a summary. First stitch was taken here. Now I'm taking a bite from here, and now see what I'm going to do. Now just have a look at what I am going to do. Okay, so there is a loop through which I am taking the suture. I didn't just pull the thread, I pulled the thread back through the loop. You can see it again. I'm going to take one more bite of this. You can see it again. It's not the same that we did before. I am taking a bite. Okay, then I will come out from the other, and then you see what I do. And I'm doing this a little slowly, purposely for teaching purpose, so you understand what is exactly happening. Now see, I have made the loop, and I will pull this thread back in. I will pull this thread back in. I am doing it really slowly for you to understand what I have done. Yeah, so you got it. Started from here, took the bite, went out, took the bite, went out. This is called a interlocking suture or a continuous interlocking suture. Okay, so I hope you guys understood the kind of suturings that are being done, basic kinds. Okay, and this was the suture material. See, this was the suture I showed you. It was a cutting or a reverse cutting. If the cutting edge is outside, then it is going to be reverse cutting. As you see over here, it's written over here, reverse cutting. Ethylon. Ethylon is the trade name. It means nylon. Okay, it is a black suture or vicryl, extremely important. 30 vicryl. You see, round body vicryl. Where will you use round body vicryl? If you're doing bowel, soft tissues, right? So this is how you understand the suture by the needle and by the suture material. That is the basic of a suture. And the suturing types. What did I first tell you? First, where to hold the needle. Always hold the needle at anterior 2/3 and posterior 1/3 junction. Okay, anterior 2/3 and posterior 1/3 junction. Then, what did I tell you the types? The most basic type of suture that I'm going to do, simple suture or interrupted suture. And then there were some special types of suture that I performed. One was vertical mattress. In vertical mattress, I took big bite, small bite, and small bite. That's how you remember. Big, small, small, all in the same line. Okay, all in the same line. If you look at it from the side, if this is the wound like this, okay, and I'm going to suture it. If you look from the side, I take a big bite from here, come out from here, Then go back, small bite from here, come out from here, and I tie it. Okay, this was vertical mattress. Then the other special type of suture that I did, that was horizontal mattress. So how did I perform horizontal mattress? Also called as box stitch. It was big bite, big bite, big bite in the side, plus big bite in the side. This looks better if you see from the top. Okay, if you see from the top, you don't need to see this from the side. Horizontal mattress, you can see from the top. I enter from here, come out from here, then I go down. Enter from here, come out from here, and I tie like this. It looks like a box. That's why it's called a box stitch. Where do I use box stitch? In deep cavities where there is deep source of bleeding for hemostasis. And the third type of suture was the continuous suture, which I use when I need watertight anastomosis, and continuous with interlocking suture. Okay, continuous with interlocking suture. So I hope I am absolutely clear on the different suturing types. These are the basic types that we need to know. If they ask you a video MCQ from this, then definitely you should get it now. Even otherwise, if in your real practice, those of you are going to be interns, you need to know these kind of sutures. Okay, it will help you to become a good doctor. If not, also solve the MCQs. All right. So I hope you enjoyed this class. I have another YouTube session coming up in some time that is on step by step of inguinal hernia. Do stay tuned for that. And you can ask your doubts there also. And do follow me on Telegram. This is my Telegram link. And do remember to like this video and share it with your friends. Okay. So thank you for joining me, guys. Take care and have a good day.